I suppose, I speculate that sometime, somewhere in your past, something tripped your trigger for freedom that made you perhaps a little different than your colleagues, that made you realize how important freedom was. Well, that day happened for me 23 years and 1 day ago. Perhaps you didn't know that yesterday was the 23rd anniversary of President Clinton standing in front of the national television audience and waving the national security card and talking about his Health Security Act and how everybody was going to have coverage. And that's the first time I ever sat and listened to a president talk the whole time. And I took notes. And I said, this can't happen, because if we lose health freedom, we lose freedom in this country. And God gave me a freedom bone a long time ago, and I could see the threat. So out of that, Citizens Council for Health Freedom emerged, and for 22 years we've been fighting against HIPAA. Thank you for recognizing that HIPAA is just it has nothing to do with privacy and everything to do with non-privacy and taking away our rights. We've been fighting managed care, and we've been fighting state and federal regulations, Obamacare, MACRA, the whole kit and caboodle that are all about driving us to socialized medicine, maybe with fancy words and euphemisms, but all there. But now, as one person has said to me, she said, you've gone on the offense. You've gone a different direction. You've gone towards something and not away from something. And so we have, and what she meant was that we have launched the Wedge of Health Freedom. And essentially this is to bypass it all. So you know what they say. If you can't beat them, bypass them. In bypassing them, what if we could escape Obamacare? What if we could escape government-run health care altogether? So you know very well what the problems are with the current system. High prices, government reporting, prior authorization, one-size-fits-all treatment protocols, narrow networks, intrusive questionnaires, no consent for data sharing, impersonal bureaucratic processes, long waits and short visits, managed care controls. But what if we could set patients and doctors free? So we launched the Wedge of Health Freedom to do exactly that. We call the Wedge a free trade zone for healthcare, a protected legal space that is free from intrusions between you and your patients. This is kind of how we envision it going. And we know it's not going to be short or quick, but today we have a Wedge of Health Freedom. We have it today, but it's invisible. So look at those little lines, right? Those little dotted lines there. It shows how to most of the American public, it's invisible. But tomorrow, we want to make the Wedge visible to the American public. The space where doctors and patients are freely interacting with each other without interference. And we want to grow it bigger. And then in the future, we want the Wedge to consume the entirety of healthcare. We want the direct patient relationship between the patient and the doctor to be the only thing that is, because we view that as the only right way for you to practice medicine. Not to have interlopers, not to have interference, but to be directly connected with your patient and not interfered with. So joining the Wedge means following these 8 principles. If you're a practitioner, if you're a patient, it means this is what you get. Transparent, affordable pricing, freedom to choose, true patient privacy, no government reporting, no outside interference, cash-based pricing, protected patient-doctor relationship, and all patients welcome. We view this as medical tourism in America. Now, probably you know that Blue Cross Blue Shield will send your patients to Thailand or Costa Rica or other places where they are not under our 132,000 plus pages of Medicare regulations or 20,000 plus pages of Obamacare regulations, and they aren't under Medicare contracts and lawyers and billers and coders and all of those folks, right? But why should Americans have to travel to Timbuktu to get care? So we look at this as medical tourism in America, where it's affordable, passport-free, personalized, and 100% American-made. With the Wedge, we're hoping to restore the relationship between the patient and the doctor, so it's just you and your patient. When patients look at this, they'll see you and your doctor. So healthcare delivered directly to patients. There's no outside controls. There are patient contracts. The principles of privacy, personal choice, and affordable pricing are in the Wedge, and government and insurance corporations are kept out. Today we have what's called a maze of managed care. You know it well as a practitioner. And some of the things that we list there as obstacles between patients and doctors include the penalties on doctors for not going along with the protocols, the government reporting, the EHR mandate, population health. Most of the public doesn't even know anything about population health, but of course that's the buzzword, particularly in the ACOs, everything about taking care of the population rather than the patient. And of course there are delays and denials and more. And so this is a very intimidating thing that the patient has to go through to get to their doctor, their hospital, exactly what they need in healthcare. So the Wedge, we want to bring the patient and the doctor back together and skip the maze altogether. And we want the patient to have a direct relationship with their doctor. We also want the patient to have a direct relationship with their hospital. So eventually we envision not only Wedge practices, but Wedge hospitals. And here's one way to look at it. When I was talking to members of Congress after we launched the Wedge in June, I got to the point where I did this diagram to explain to them. And so today what we have is the payer on the top of the triangle and the patient and the bottom on the patient and the doctor on the bottom. And everybody has to go up to the payer to figure out exactly what's going to happen and how much money is going to happen, and do they have to get permission first. And so it's sort of like Mother May I medicine. And what's not in that triangle, but you know well, is a whole lot of money. There's a whole lot of money wasted to go up to that payer all the time, and both in time and in dollars. In the future, what we want are 3 direct relationships for the patient, one with the doctor, one with the hospital, one with the insurer, and we call this going back to the future, because that's how it used to be. And the insurance company didn't get in the middle between you and your patients, because they just had a defined contribution. They were an indemnity policy, and so it was pretty easy. And it was full of non-interference, and people actually knew what the prices were. So here are a few clinics that are using Wedge principles. There are also other clinics that are in this room that are not mentioned here. Atlas MD, Patmos Emergent Clinic with Dr. Robert Berry, and Dr. Michael Robb's clinic is in here, the Neurology Clinic in Arizona. In the Wedge, we tell patients that care is patient-friendly, price-friendly, and privacy-friendly. And on August 31st, we launched our map of freedom. And there is a page on our website called Find a Practice, and patients can go there and find a doctor in their neck of the woods and see if there is one. There are lots and lots of doctors who could be on here, who could be on this map that are not on this map. And it's our hope to get all of them possible that are on the map. I did hear from Tom. Are you here? Tom Paponis yesterday came up to me and he said he had his first Wedge patient that had found him. Yes, that was just splendid to hear, and not anybody who had even heard it on one of our radio stations around the nation. We're on almost 800 radio stations, this little Health Freedom Minute, and just found it online, so that was exciting. Practices, eventually we'll hope to have a decal sort of like this for practices to have on their doors if they want them. We want you to know that the Wedge is for everyone, insured, uninsured, and even the publicly subsidized. As you may know, Dr. Berry at the Patmos Clinic, he sees lots of patients that are on Medicaid, but of course he sees them timely, he sees them at an affordable price, and they don't feel any stigma in his office, which sometimes they feel elsewhere. So it's healthcare between you and your doctor, or you and your patient, and this is where our website is at jointhewedge.com. And we invite all of you, if you are interested in this, to actually sign up to be one of the practices. Now, when you think about the wedge, the whole idea here is to put you and your patients back together again in a relationship that's ethical, confidential, patient-friendly, and affordable. And we know it's possible. Actually, I talked to somebody, a congressional staffer. Actually, there were many interesting conversations with congressional staffers. One congressional staffer, age 24, did not know that you could go to a doctor's office without insurance. Another one was just talking about her own experience and talked about how much the difference was between what the health plan actually paid and what the charge was. And it was it was almost just a third that was paid. And I said, so can you imagine how inexpensive it could have been if it had been a Wedge hospital and it didn't have to follow 132,000 pages of Medicare or 20,000 pages of Obamacare? How low could the price have gone if it didn't have any managed care contracts? What if it was just between you and the hospital and they didn't have to have all those folks? And so we are trying to build in people's minds a different way of doing healthcare, which is not really different. It's back to the future. So we want to restore the heart of healthcare with the wedge. We hope to bring hope back to patients and doctors. And the whole idea here is even if Obamacare never gets repealed, we just go around it, right? If you're not under the regulatory structure and you don't sign the contracts, you're free. And so we understand that this is not going to be quick, but we also understand that there's lots of doctors who are either going that direction already, who have already arrived, or who are thinking about it. So let me just tell you the story with my orthopedist. So recently I broke my toe, and I went to an orthopedist, and at the end of it she said, is there anything else you need? And I said, or anything else you want to ask me? I said, no, but I have something to give you. So I gave her this card here. This is our practice invitation card, and it says your practice can escape Obamacare. And so she took this, and she sat back down, and she took this. And she's reading it, so she said, oh, this is great. Then she looked up at me, and she said, you mean all I'd have to do is my job? She said, that's wonderful. I'm going to look into this. Now, what I know is she's got 6 doctors in her practice. They take Medicare. They sign contracts. It's not going to be a small journey for her to go from where she is back to freedom. But I planted a seed, and she saw it, and you could see it in her voice and in her eyes, right? She wanted to be free. And I believe that every doctor in this country would like to be free of the managed care and Medicare morass that we have today. I believe everybody wants to be free. And we just have to light a fire and plant a seed. So 7 things I want you to understand about the wedge. First is we're building something new in the minds of the American people. And I know for you, you probably might even think this is old hat, direct primary care, that's already happening. It's been happening for years. But I'm telling you, when I mention this to just the person like out on the street, they say things like this to me. This is revolutionary. I love it. This is refreshing. Wow, that's exciting. They are in a managed care mindset because this is how they have grown up, and they're not looking at policy like you or me or anybody else. The second thing is that this is not just a free trade zone for healthcare. The Wedge of Health Freedom is also a national initiative that we have to, yes, we have branded the Wedge now. We've branded the free trade zone as the Wedge so that the public could grasp it as something that they could actually say and maybe start to feel as a reality. But it's also to tell them about it, to introduce them to it, to tell them the attractiveness of it, and to allow them to invite their doctors into it, to start planting the seeds in their doctors' minds. Third, the wedges for practices that are truly and fully free. We want to be able to tell people when they go to a wedge practice, absolutely not one scrap of their data will be shared. They will have affordable pricing because all of that bureaucracy is gone. 4, we are starting with cash-based practices such as direct primary care, but we're not stopping there. Our whole plan is everybody. And 5, as I said, we know doctors want to be free. 6, Rome wasn't built in a day. So we know this is a process. It's definitely a process, but our aim is freedom. And the 7th is that Obamacare is actually helpful to us in this movement towards freedom. Look at these high deductibles that people are complaining about. Most of them will never reach the top of their deductibles. Why not pay cash and or why not get care at a less expensive rate, pay cash for it, and at the end of the day have more money in their wallet? And then health sharing has skyrocketed, like 3 times as many people now that Obamacare has started. So it's gone up significantly, and that's all cash-based. I'll just let you know as I'm concluding here that some of our goals are. We'd like every independent opted-out practice on our map. We'd like patients everywhere inviting their doctors and planting the seeds of freedom. We want to peel doctors off of group practices and out of the ACOs. We want no more managed care networks and the end of ACOs. And we want to put the wedge on the lips of members of Congress, news reporters, patients, and doctors. We just want to build a vision of freedom in healthcare, affordability, patient-centeredness, and confidentiality. We want to bring it back. We are not stuck with Obamacare. Okay. Ultimately, when we're successful, there will no longer be a wedge. There will be freedom for all. So this is no small endeavor. I encourage you all to join with us. It's such an important thing for the freedom of our country. It's so important for our patients. And I thank you so much for your time and attention.
Thank you, Twila. Really great presentation. I hope all of you go to jointhewedge.com and take a look at it and join up.